I'm dermatologist Dr. Abby Waldman. I am a board-certified dermatologist with 8 years of experience. I am also assistant professor at Harvard Medical School, and I'm going to get you started on tretinoin for wrinkles or acne with little irritation or pain. So let's get to it. This video is for you if you are a beginner, if you are naive to tretinoin, or if you have failed in the past because of irritation, redness, scaling, and you want to give it another try. Whether you are using it for anti-aging, wrinkles, acne, pigmentation, you'll learn the best way to apply, what skin changes to expect, both the good and the bad, and some hacks for optimizing use. So first off, what is the right way to apply tretinoin? So you are going to use a pea-size amount. This is a pea, this is a pea-size amount. It's about 2 to 3 pumps. You're going to apply it on your face and your neck. To begin with, you may want to avoid your eyes and areas around your mouth and nose because those are the most sensitive areas. If you've been using tretinoin for a long time, often you can use it in the areas around the nose, mouth, and the eyes, but to start, avoid those areas. When you start, you're going to start at night only and every 3 nights. So do not start every night or else you're going to get a lot of peeling, a lot of redness, and irritation. Do it every 3 nights or even less, just once a week if you have very, very sensitive skin. You're going to do it every 3 nights for the first month, and then if you're tolerating that okay, you're going to apply it every 2 nights for the second month, and then every night as tolerated. You're going to apply moisturizer after you put on your tretinoin. So you're going to apply just whatever moisturizer you like and you'll use. So as a dermatologist, some common complaints that I get about starting tretinoin is redness and peeling and pain. It also causes sun sensitivity, which is why you want to use it at night. And during the day, you're going to use sun protection. Here are some tips and tricks to deal with these side effects. 1. It is okay to just stay at a few times a week. This is a marathon and not a sprint. You are going to get benefits just from using it a few times a week. If your skin really doesn't like it using it more frequently, do not fret. 2, do not use a chemical exfoliant like an AHA, BHA on the same night that you use your retinoids. At least not consistently. Both of these can be quite irritating when used together, and so you may end up getting more irritation and redness. I recommend, if you're using a chemical exfoliant, to do this 5 nights a week and do this 2 nights a week. And that way you'll kind of get the benefits from both, but without the incredible irritation from using them both together. Now, everyone's skin's a little bit different, so you might want to play with that and just listen to your skin and see how you react. So 2 nights a week may be too much for chemical exfoliant and maybe too little for others. 3, generally tretinoin is applied to clean skin. But if you are getting a lot of irritation and redness, I find the best trick is applying some sort of serum first. Find a hyaluronic acid serum, a snail mucin, a peptide serum. This is a great balancing and clarifying serum. Any of these apply some moisture to the skin first, and I find decrease the irritation from tretinoin quite a bit. Alternatively, you can just put moisturizer on first and then the tretinoin followed by your normal moisturizer. This is called the sandwich method. Moisturizer, tretinoin, moisturizer. These are great ways to decrease irritation. I find they help quite a bit if you're having issues starting. If you are getting a lot of redness here, a lot of peeling around the mouth, irritation around the eyes, it hurts when you're talking, take a few nights off. There is no harm. Remember, this is a marathon. We don't want you to get injured and not be able to reach the end. This is about the long haul game, even if it's for acne, if it's for wrinkles, if it's for pigmentation. So take some nights off. Use a zinc-based barrier cream during those nights and don't do any other skincare except for washing your face. And what do I mean by a barrier cream? Even just Desitin diaper cream is a zinc-based barrier cream. You can get Roche-Posay makes Cicaplast Balm. Aven makes a wonderful zinc-based barrier cream to use at night. That's really gonna help relieve some of those symptoms that you're having and also just give your skin a little bit of breather for a few nights. Allow you to rebuild your skin barrier. 5, be really cautious about the sun. Even when you're using it at night, you can still get sun sensitivity. You're really gonna feel it by having a lot of redness and irritation when you go out in the sun. Make sure you're wearing a hat, wearing sunscreen and sun protection, trying to stay out of the sun between 10 a.m. and 2 p.m. 6, A purge of acne is actually very normal and expected when you are first starting tretinoin. If you are acne prone, this is more likely to occur, and it often lasts several weeks. So you might notice nothing for a few days and then several weeks of increased breakouts. And then once you get over that hump, you are gonna be clear skin. So it's worth it to push through. Obviously, if after several weeks, about 8 weeks, you're not noticing any improvement, talk to your doctor. But most of the time by 12 weeks, this has resolved. Do use moisturizer over your tretinoin, again, to decrease some of that inflammation. And also just make sure you're not starting other products at the same time. So don't start your tretinoin and then also start a serum at the same time and a new moisturizer at the same time, because if those are causing acne breakouts, it's gonna be really hard to differentiate which product is causing the issue if you're starting tretinoin at that time and expecting to see breakouts. Oftentimes patients come to me and they say, I've been using this 4 months and I haven't seen this effect. I haven't seen any improvement. And like so many things in life, often with tretinoin, it's all about patience and expectations, right? So what to expect for your skin when starting tretinoin. So in the first 4 weeks, you may actually notice some improvement in your skin texture, a little bit shinier, more glowy, but you might also notice some of those purging, the acne that I mentioned previously as well. It's normal to see a little bit of peeling. A lot of peeling is too much, and again, back off from what you're doing to decrease the frequency of use and use some of those tips I mentioned. For acne, it can often take up to 12 weeks to see improvement. You kind of got to get over the hump to really get on the other side and get the improvement that you're looking for. So be patient and know it may make it worse before it gets better. For hyperpigmentation, you'll often start to notice improvement in about 2 to 6 months. That improvement is actually going to be quickened if you are using other anti-hyperpigmentation products like tranexamic acid, azelaic acid, hydroquinone for sure. All of those are going to speed up hyperpigmentation resolution, but in general, you should see some resolution in 2 to 6 months as long as you are not getting any significant sun exposure. And then for wrinkles, you're gonna see improvement in about 3 to 12 months, depending on how severe your wrinkles are. Obviously, the less severe, you're gonna notice improvements faster. If you have a lot of deep set wrinkles, you may not even start to notice any improvement until up to a year. And all of this is gonna depend on the frequency of use. The more frequently you use it, usually the faster you'll see results, but the faster you may see those side effects as well. In the United States, tretinoin is prescription only. It is contraindicated if you're pregnant and breastfeeding. It is often not covered by your insurance, just FYI, at least in the United States, unless you are under 18 and you have acne. Even if you are over than 18 and you have acne, generally it's not gonna be covered by your insurance. I found the most affordable way to get tretinoin is actually through a compounding pharmacy, and they can often compound it with other ingredients. This is actually my tretinoin that is compounded with niacinamide and hyaluronic acid. So you kind of get some other benefits with that product. It's also a little bit cheaper than if I went just through the typical pharmacy. So I find that that's been a hack to get a little bit more affordable. Also, you can sometimes use these coupon programs if you are going through a pharmacy like GoodRx, other coupons where it will kind of decrease the price from say $200 to maybe $40 to $60. There are many different compounding pharmacies. This one is Skin Medicinals, which I like, but you can talk to your doctor about that if cost is the biggest issue in starting tretinoin. Let me know in the comments what your experience has been. Let me know if any of these tips are helpful. Certainly like this video if they were helpful, and follow for more skincare and dermatology tips. I'm Dr. Abby Waldman. Be well.